Doctor, please raise your right hand. Do you solemnly swear or affirm the testimony you give today will be the truth, the whole truth, and nothing but the truth?
I do.
Thank you.
All right, thank you. Good morning, Dr. Benedict. My name is Matt Kahn. I represent the Thomas family. Will you please introduce yourself to the jury?
My name is Dr. William Benedict. I'm a neurosurgeon at Canton Hospital.
And doctor, thank you for taking the time away from your practice to be here today. So today we'll cover three areas. We'll cover who you are, Kendall's treatment, and then Kendall's future. Does that sound good?
Yes.
Okay. So doctor, what kind of doctor are you?
I'm a neurosurgeon.
And what does a neurosurgeon do?
A neurosurgeon treats patients who have surgical problems of the brain and the spine. So that includes everything from treatment of brain and spine tumors that need to be removed, treatment of brain and spine injuries that require surgery, treatment of some degenerative conditions of the spine primarily that require surgery.
Okay. And doctor, will you please walk us through your educational background?
I did 4 years of college at the University of Scranton in Pennsylvania, where I got a Bachelor of Science in Biology with a minor in Spanish. I then did 4 years of medical school at Loyola University Chicago, Stritch School of Medicine. I did a 1-year general surgery internship at Loyola University Medical Center in Chicago, and then a 6-year residency in neurosurgery at Loyola University Chicago, Hines VA Hospital, and Cook County Hospital.
Okay. And doctor, what did you do after your residency?
I moved to Atlanta and spent 3 years as an assistant professor of neurosurgery at Emory, where my practice was primarily out of Canton Hospital.
Sorry, I didn't mean to cut you off.
And then I left Emory's employment in 2010, staying at Canton, but I became an employee of Wellstar Health System.
Doctor, what does it mean to be board certified in a particular area of medicine?
Board certification in neurosurgery means that we've completed medical school, completed an approved residency, taken a lengthy written test, and then had our initial practice reviewed by a board of neurosurgeons, and then we've been given an oral examination confirming that we have the knowledge and appropriate to a neurosurgeon and that we're safe to practice. And the entire process takes, in addition to the 7 years of residency, 4 years of medical school, that takes an additional 5 years after residency to complete.
And do you have any board certifications?
I do. I'm certified by the American Board of Neurological Surgery.
Okay. How long have you been practicing medicine?
As an attending physician since 2007.
And before 2007?
I received my medical degree in 2000, but 2000 to 2007 I was a physician, but I was in residency, I was in training.
Okay. Are you licensed to practice in Georgia?
I am.
And where do you work, doctor?
Primarily at Wellstar Kennestone Hospital, Wellstar Kennestone Regional Medical Center.
At this time, plaintiffs will tender Dr. Benedict as an expert in the field of neurosurgery.
No objection.
Dr. Benedict, before we get started, will you agree to give all opinions today to a reasonable degree of medical certainty?
I will.
All right. So, doctor, now we'll move on to the area of Kendall's treatment. If you don't mind telling us, how did you come to treat Kendall as a patient?
On the day that Kendall came in, I was on call for neurosurgery, which means that I was available for any and every emergency that might require a neurosurgeon. I received a phone call from Kendall was activated as what we call a Tier 1 trauma, which means that she was critically injured. And patients who come in as a Tier 1 trauma are met in the emergency department by the trauma service and anesthesia in the event that an anesthesiologist is needed to help them breathe. She was in the CT scanner, the CAT scanner, when the anesthesiologist saw her initially and had concerns that she had a head injury, and he called me while she was in the CT scanner.
Okay. And could you just explain to us what a CT scan is?
CT scan is a sophisticated X-ray of the skull and brain that helps us to identify injuries.
And what was Kendall's condition when you first saw her?
When I met her, she was on a ventilator. She was unconscious and had the appearance of someone that had been injured.
Okay. Did you perform any surgeries on Kendall while she was in the hospital?
I did. When her CT scan was done, she had a blood clot overlying her right brain, and her neurologic examination was significant for her right pupil being larger than her left, and that's an indication to us that the pressure in her brain from the blood clot was threatening her life. So she was taken immediately to surgery.
And what surgeries did you perform?
The first surgery that I did that day was a right-sided brain operation to remove the blood clot that was threatening her life. When I completed that operation and examined her in the operating room, she had evidence of progression of a left-sided injury. We got an immediate CAT scan right from the operating room, and she had developed bleeding on the left side, requiring another operation to be done right there and then. So I did two operations on her very soon thereafter meeting her, and then we transferred her to the intensive care unit.
Okay. And was the first procedure a right side craniectomy?
It was a craniectomy.
And the second procedure was a left side craniotomy?
Correct.
And could you just briefly explain the purpose of a craniotomy? Or, craniectomy.
Craniectomy means to open the scalp and remove bone from the skull. And when we do a craniectomy, we leave the bone off so that the brain has room to swell outside under the skin, because the skin is closed and it's no longer constrained by the presence of the skull. That was the first procedure that I did. The second procedure, which is a craniotomy, means that we take the bone off, remove, in her case, a blood clot, but then put the bone back on.
Okay. And doctor, we've prepared some animations that I'd like to show you. But before we do that, I know that you've seen them before, and I'd like to just ask, do they fairly and accurately depict the procedures that you did on Kendall?
They do.
Okay. Brian, if you will please play the animation of the craniectomy, excuse me. And doctor, I'll just ask, while the animation is playing, if you would explain what is happening for the jury.
Yes.
And if you need us to pause it at any time, just let us know.
Take it. Maybe you want me to hold it. Thank you. Okay. So this first animation shows the right-sided procedure. That was the craniectomy. So this is the incision being made. We use an incision that is a reverse question mark to give us adequate access to the skull. That skin is then rotated forward over the patient's face, and you can see the underlying bone. The next instrument that we use is a special surgical drill, and we create holes around our planned piece of bone removal. That bone removal is called a craniotomy, or a bone flap particularly. So you see the burr holes here. We then use another specialized drill called the craniotome that allows us to connect the holes together safely so that we can then remove the bone that's been outlined. And the bone flap is the craniectomy. Under that layer, under the bone layer, is the covering the brain called the dura. It's a tough, leathery-like material that we open, and that's being opened here, and is also being rotated over the patient's face. Underneath that is the blood clot, which is on top of the brain. And the subdural hematoma that you see here is what was causing her problem, and that's suctioned out. Underneath the blood clot is the brain that's been injured. And the contusions that are identified here are bruises on the brain. And some of those were removed to create more space for the brain that was not injured to swell. The ventricle is a hollow portion of the brain that contains fluid. That fluid is normal in the brain. It's called cerebrospinal fluid. We will put drains into that space to drain that fluid to create more room for the brain to swell, and also to allow us to measure brain pressure, because we don't want that brain pressure to be too high. The opening of the brain is covered with a material called duragen. The covering of the brain, the dura, is flapped over that, and then we close the skin. But the bone is left off to allow for brain swelling. Immediately after this procedure is done and we put a dressing on, we check the patient's pupils because her right pupil was bigger than the left, and I wanted to see that come down. And that right pupil had come down, but the left pupil had then dilated. And that tells me that there's something problematic on the other side.
Okay, and if Brian, if you wouldn't mind playing the.
I got it.
Thank you.
Okay.
And as we're looking at this animation of the craniotomy, Doctor, if you'll just walk us through what's happening.
So after seeing that the right pupil had come down, so normalized, the left pupil was now dilated, we went from operating room to CT, and the CT scan demonstrated that a small amount of bleeding that was on the left, known originally, had expanded, and had expanded because the pressure had been released from the right side, so now the left side was no longer controlled, and she required a craniotomy on the left. So here you'll see the same incision that was made as on the right side. Reverse question mark incision where the skin will be rotated over the patient's face. You see the underlying bone again. She had a fracture of the skull on this side. The same drill to make the holes was used to outline the planned craniotomy or bone removal. The same drill, called the craniotome, was then used to remove a bone flap. Underneath the bone flap, this blood clot, which is called an epidural hematoma, is located over the covering of the brain, and it was coming from an injured vein underneath this fracture. That blood clot was removed using a suction. The covering of the brain, the brain covering has blood vessels, arteries. See additional blood being removed. The bipolar cautery is a device that we use to control bleeding, and the vessels to the covering of the brain were closed down with that device. The vein that you see here, this blue structure, which was injured, which the cause of the epidural bleeding, was controlled by applying this material called Surgicel. The covering of the brain was then opened, revealing actually a small subdural hematoma as well, so same type of bleeding as on the other side. That was removed. The covering of the brain was closed with sutures, and then the bone is replaced on this side. She didn't require that the bone remain off on the left side. The bone is placed with these small metal plates that cover the burr holes, and they're screwed into place with small 4mm screws. The surgical drain was placed underneath the skin that's outside the bone. And then her incision was closed with suture and staples. And then she had some cuts on the skin, lacerations that were also repaired.
Thank you, Doctor. And at this time, plaintiffs will tender the animation of the craniectomy as Plaintiff's Exhibit 4.1 and the animation of the craniotomy as Plaintiff's Exhibit 4.2.
No objection.
Doctor, were Kendall's 2 brain surgeries successful?
They were.
And how so?
After the second operation, her left pupil returned to normal. And so by the end of her second surgery, she had equal pupils on both sides. We had control of her brain pressures.
And did you do any other procedures other than these 2 that we just discussed?
I did additional procedures several months down the road. Because the bone flap was left off, that had to be replaced on the right side. That required an additional procedure. So that was an elective reconstruction so that her skull would be normal. She then required one additional surgery called a shunt that hollow portion of the brain containing fluid. She required a permanent means of draining that fluid because as a result of her trauma, her brain could not process that fluid normally. So I placed the shunt soon after I put the bone back on, did what's called a cranioplasty.
Okay. And what's the recovery like following these surgeries that you did?
For the elective operations, meaning the replacement of the bone, which we call a cranioplasty, and the shunt, the recovery is in total about 2 months. Now that's 2 weeks for the wounds to heal and staples to come out. And total recovery for patients that have these procedures done for other reasons is conservatively 2 months.
Okay. And what about the craniectomy and the craniotomy?
Takes about 2 weeks for those wounds to heal, but with the wounds are healed at 2 weeks, but the recovery from the injury can be weeks, months, years.
What are some potential surgeries that Kendall might need in the future, if any?
Revision of her shunt, that device that's taking the brain fluid out and actually diverting it into her stomach. Those devices will occasionally fail. They don't have a very high rate of failure, but they can fail. And if that device, which is a mechanical device, fails, it would need to be replaced or revised.
Okay. How often did you see Kendall during her initial hospital stay?
Every day she was admitted to me.
And have you seen Kendall since her initial hospital stay?
I have. She periodically follows up with me in the office.
Okay. Approximately how many times have you seen Kendall since that initial hospital stay?
Approximately 3 times.
Okay. And when was the last time you saw her?
It was within the last few months.
Okay. So now I'd like to move on to this third category of questions, Kendall's future. And so I'll start by just asking, how's Kendall doing now?
Kendall is in a motorized wheelchair. She's able to speak very softly. She's got significant impairment of her ability to think. We call that cognitive impairment. She's able to feed herself with some degree of assistance. She depends on her parents for bathing and moving in and out of her chair and getting in and out of bed and getting in and out of a car, getting to her doctor's appointments. She's weak on one side, on the left side.
Okay. Before we get into the next question, can you just explain what activities of daily living are?
Activities of daily living are basic fundamental functions that we as people need, and they include getting up, bathing, dressing, feeding ourselves, getting food for ourselves, getting in and out of the home to do things like work, get food, transferring in and out of chairs, in and out of bed.
And how have Kendall's injuries impacted her activities of daily living?
Her injuries have impacted essentially all of those activities of daily living.
So bathing,
Eating.
dressing.
She can feed herself to some degree, but someone has to bring her the food. She can't drive. She can't transfer in and out of her motorized chair without some assistance.
Do you think Kendall will ever be able to play competitive sports again?
She will not.
Do you think Kendall will ever be able to work and support herself financially?
I don't think so.
Do you have an opinion as to what caused Kendall's brain injury and the limitations that you just described?
She was injured in a trauma. The history that was given to me was that she was struck by a car.
Okay. What's the probability of Kendall making a full recovery?
Very low.
And Dr. Benedict, I think I just have one last question. Will Kendall be disabled for the rest of her life?
She will.
Thank you, Dr. Benedict. Those are all the questions I have for now.
Dr. Benedict, my name is Joe Rahimi, and I represent Ms. Field, the other person that was involved in the accident that occurred between Kendall and the automobile.
Yes.
You said that you were the admitting physician for Kendall when she was admitted to the hospital.
She was initially admitted to the trauma service. I was a consultant. I took her care over after surgery.
Once you took her care over, did you do everything within your power to help her and provide the treatment that she needed?
I did.
Okay. Have you been doing that since you began treating her?
Yes, most of her care now is rehabilitative care. So her primary physicians are rehabilitation physicians.
But you stand ready to help her as she needs
Yes,
and as time goes on.
yes,
Okay. And you standing to help her as she needs is without regard to any litigation that's ongoing, correct?
that is correct.
Okay. Have you done everything in your power to help Kendall along the way and to treat her for what she needs?
I have.
Are you aware of anybody that has been treating her that hasn't done everything within their power to help her as she needs and as they deem necessary and fit?
No.
That's all I have. Thank you.
Okay. And I just have one more question, Doctor. Do the things that we wrote down on your roadmap, is everything appear accurate to you?
Yes.
Okay, thank you. And we'll just mark this roadmap as Plaintiff's Exhibit A. Thank you for your time, Doctor.
I do have one last question. Do you expect Kendall to improve as time goes on?
She may slowly improve as time goes on.
Thank you.
It's just hard to predict
Yes, sir.
what that will look like.
Thank you.
You're welcome.
Afternoon, I can hear.